Cronin Toyota and Cronin Nissan are honored to partner with Proudly We Served, as well as the continued support of our local active and retired military veterans across eastern Indiana.
Bledsoe.
I'm Ron Chappell, co-host here with Elliot Proudly We Serve. We're going to continue our discussion with Joe DeVito.
Joe is the outreach director for the state of Indiana. You know, when I first got involved with the VA system, my brother was in the military also, so we applied at the VA for the medical part of it, and he didn't get accepted because he made too much money, and yet I made the same amount of money, even maybe a little bit more, but I was a Vietnam guy, and back in those days, that barometer of Vietnam guys, if you will, you went to the front of the class. It's kind of not that way now. I think Afghanistan, Iraq, and those guys that have really been injured over there, and some of them, it's almost unthinkable.
Right.
Some of the issues that are out there that
And in the healthcare side of things, VA healthcare, those are the things that if you get a little guidance on it. So the VA, the way they do their veterans healthcare is they have priority groups. They'll class a veteran in a priority group. From 1 to 8, there's 8 of them. The VA doesn't necessarily, I believe they don't deny you enrollment in VA healthcare, but if you make too much money, you're in priority group 8, which is maybe you don't get seen. So you're not, so that's how that would work. But there are, household income is one thing that has to do with that. Your discharge type has to do with your eligibility for VA healthcare. Sure. But there are things that eliminate the barrier of income. So one is if a veteran has a service-connected disability rating. If you're service-connected disability, if you have a rating, you are enrolled in VA healthcare. Doesn't matter, financials don't matter and all that. There may be co-pays involved, small co-pays, depending on income and the rating. So like a 0, and I'm throwing numbers out because I don't have the charts in front of me, but like a 0 to 10 or 20% disability rating might put you in a priority group 4 or 5 or something like that. I know if you're service connected at 50% or higher, you're priority group 1. And priority group 1 doesn't have co-pays. So there's those things. And Vietnam service. If a veteran served in Vietnam, they get into VA healthcare. If a veteran has Afghanistan, Iraq, and other Persian Gulf War duty, they get into VA healthcare. So there's all these different ways and avenues and things to understand.
Sure.
Where that's where it's important to get some assistance with filling out those forms. And the county veteran service officers really, they can help you get stuff the first time. Which is really helpful because it gets frustrating and veterans get frustrated, and I understand that. Getting denied.
Ron,
Ask me how I know.
I think he generally knows. I mean, when he's taking a nap or whatever he's doing, he generally knows if that's going to fly or not. I mean,
yes.
I mean, he's smart enough to know how all that works, I think. So.
Yeah, and our CVSOs, they have a support network as well. So, they have a vast amount of knowledge. But if they needed to know something, they do have our district service officers. We also have we work in close relationship with the American Legion National Service Office in Indianapolis and the DAV and the VFW as well. So we've got a network of knowledge for our CVSOs to tap into if they need it to work with veterans and put those claims in.
What about housing? I've run into some guys who are street people, but they're veterans.
Yep. So with the housing, the federal VA has the HUD bash. I'm not going to try to pretend to get all the acronyms right, but that stands for something. And it has to do with the urban and housing development programs federally as well. So the VA has a program. and it's a VA program as well as they administer grants to housing for veterans at risk, for homeless or homeless veterans. There's programs abound in the state. One of the things that is I'm so proud that we do is there was money in the budget for grants for veteran services with an intention for homeless and at-risk veterans. So what we did a few years back was we looked at this chunk of money, which was not the kind of grant money the federal government gives out, but IDVA, we had the opportunity to grant money out,
Sure.
or to use money. And one of the things that we discussed, and Director Weimer was spot on, I think, as well, was let's not take this money and start trying to provide services as IDVA. We're a small government agency. We're housed in Indianapolis. Do we have the skills and manpower, and is this going to give us the type of budget to start providing service across the state? And it really would not be, being great stewards of tax dollars. That would not, and it wouldn't reach the veterans, most likely. And then also, it's a state agency. As things change in the world and in the state, that's probably not adaptable in a timely manner. So one of the things that was decided was instead let's use this money and create a grant program for all the organizations who are already across the state doing this great work, nonprofits, church organizations, anyone who's doing this work, feeding folks, helping veterans get off the street, helping veterans who are at risk and finding helping them find homes. So we created a grant program, Grants for Veteran Services, that we give out this money now. I think there's fiscal years involved and all that, but I think it's every year, but it's in every other year, so it's half of it per year on the grant. So we have folks apply. We have a full-blown granting process now that our legal and legislative division runs, and folks apply. We have a board of folks come in. There's some of us from the executive team. Then we bring in people from outside to help us do the selection of who gets the grants. And one of the great things too is what we do with the grant money is, since it's the state grant giving, a lot of the folks who are applying are also getting federal grants. A lot of these organizations can't exist without grant money, and that's just the way it is. And I'm so glad it's an opportunity for them. But say federal VA grants for homeless veterans, those government grants come with rules and regulations. And one of the ones I can speak of that we were noticing was in that there's an active duty component, which is a length of service component. And what we realized in conversation was some of these folks who were providing, say, homelessness or food or other services in the state for at-risk veterans, with that federal component, they were unable to use those grant dollars to help a National Guard veteran. And as you know, in Indiana, I think we're consistently a top 10, top 8 National Guard population in the country of all the states. We have a large National Guard here, and we have lots of people who were in the National Guard who are now veterans. So they were unable to do that. So what we've done and that's one example of some of those regulations that were confining and creating gaps in what they can provide. So what we try to do and what we do with our grant now is we do it for gap services. So we have one organization that we've worked with up in Northwest Indiana, Veterans Life Changing Services, and they work with up in the Northwest Chicago and Gary area, and they do amazing things. Larice and her team up there are just passionate, wonderful people. They have a housing unit, and they provide other housing. They provide transportation, job services, interview prep. I mean, they really are getting veterans directly off the street into a clean, safe place to be, and they're giving them that hand up, not a handout. And it's an amazing program.
That's kind of what Journey. Have you been to Journey Home yet?
A wonderful place as well.
Yeah. See, they do really well at that because around Richmond, if you will, I don't see a lot of homeless. If I see a veteran, and he truly is a veteran and he's homeless, I'm going to reach out. I'm going to try to help him as much as I can. Sometimes they get a little feisty about stuff like, I don't know why that is, but they just don't want to accept any help. And that's another story, but there should be, I guess it's my opinion, we should never have a homeless veteran.
That's right.
If we reach out to help that person, if he doesn't want to help, that's one thing. But if we reach out, we need to reach out to any veteran that needs help.
Absolutely.
Because that guy at one time wore a uniform. And we got to respect, I think we have to respect that. No matter what he did when he was in, we still have to respect that.
We got to make sure we don't accommodate the fake guys, the guys on the corner with the signs. I'm a veteran, and so I pulled up to this one guy. And I asked him. I said, "What outfit were you in?" And he was stumbling and trying to come up with the name of a unit. And I asked him. He said Army, and I said, "Yeah, but there's a lot of outfits, units in the Army." I said, "What was your MOS?" And he didn't know what I was talking about.
Yeah.
So I ended up chewing him out there on the corner. I told him I was going to turn him into the police.
We've
Yeah.
done pretty good in Richmond to hopefully help with that. I'd like to have a homeless shelter in Richmond similar to what Journey Home's got. But that's so hard to get that off the ground because I worked on it for a while and then just everything I turned it seemed like it was wrong. So I kind of backed off that. But the Journey Home has really come into itself this last couple of years. It's really grown. It gets, I think it's federally funded, and a lot of those guys that are up there, we support them. We have a food pantry, and we support them with that food pantry if they need any food. Why, again, that's one of those things a veteran should never go out without food.
Absolutely.
And we take that, sometimes we take that for granted. I had a situation over the holidays that a veteran needed some food. That's really sad. That in the United States of America, that veteran needs food. And you could tell he had a legitimate need. It wasn't something he made up. It really bothered me. So I ended up and took him 2 or 3 boxes of food, I think.
Well,
He had no food at all.
But there's a whole host of things that can contribute to that. We don't know to what extent this guy's or gal's exposure to combat was and what the lingering effects of that
Sure.
might be, PTSD, et cetera, and that causes a lot of people to kind of stay away from people because of the experience that they had. So,
Right.
So our job then is to figure out a way to get into them.
Right.
You see.
Yeah.
Right, and reach them in some way.
Yeah.
And a lot of times, sometimes you can get through that barrier when it's another veteran.
Yeah.
It's to mention, quick plug, your food bank is what day of the week every
Tuesday.
month?
Fourth
Fourth Tuesday
Tuesday
of
of
every month at the clinic.
Yeah.
And that's one of the other things that I was tickled to death. So in my position and working with around the state and communities, and when we first moved here, being a steward of my own advice that I give other veterans, don't mess around, get your stuff done right away. I mean, we weren't here a week, hadn't even gotten the stuff here moved yet, and I'm going to go down to that clinic in Richmond and switch, because I was in Louisville, Robley Rex VA Medical Center, and now moving here, I'm going to be attached to the Dayton VA Medical Center. So I had to switch, and so I'm like, I'm going to go to the clinic and switch. So it happened to be whatever month it was the fourth Tuesday of the month. So I come out of the clinic, and I'm looking at this food pantry, drive-through food pantry.
Yeah.
And I probably met you and Ron
Yeah.
there that day, and I chatted you guys up a little bit, and the partnership between a local community and a VA clinic to do that together is an example.
That took some doing, but once it got cemented in the ground, that Dayton, and I tell everybody, it's just a group of veterans that decided they're going to do something, And when you're all in one mind and one accord, you can get a lot done. You can't get it done by yourself, but if you got 10 or 12 good guys that are out there, and Dayton then got behind it, and Ron would tell you, I mean, it's just been almost overwhelming sometimes that it's grown to what it does, because I think it was started 3 times and never could get it off the ground. So I thought, well, I've got some time, I'm going to push.
Well,
And I started and
impressive.
now it's a wonderful thing to see a veteran come in there and look him in the eyes and know that he really has a need. He's not there to just pick up a box of food. He has a legitimate need. And that, boy, I tell you what, if that don't turn you to helping, nothing will. It's, in my life, it's changed me a lot to just know that we're able to help people. And I get so frustrated when somebody says, well, we got a certain quota, we can only do so much, and I say, what are we talking about?
Right.
Go out and buy the food if we have to.
And that drive, that understanding and passion is vital to serving our veteran community. And with all that we do when we go across the state via our district service officers, outreach events that we do, and then the other projects that we work on. So happy to say that my team has grown by one more person. This past week we just brought on, it's not official yet, so I won't reveal his name, but we went through an interview process and everything, and we're bringing on a new person to the outreach team who's going to be our health and wellness coordinator. And
That'd be good.
what that's going to focus on is veteran suicide prevention, and then any and all aspects, and encouraging, finding, and creating across the state, using health, physical and mental health, and wellness and camaraderie across to interact with the veteran community. If we could find and work with and create some opportunities for a veteran, maybe before they get to the point of thinking of harming themselves, that's what we're looking to do. We're partnering with the VA, federal VA, with 7 or 8 different folks across the state who are veteran CEPCs. I'm not going to go into that acronym either. I know the acronym, so I can only memorize so much. But they have these folks who are attached, and their job through the federal VA is to go county by county and create community coalitions that are based on suicide awareness amongst veterans, health and wellness and preventative and other information, and creating that community, that community group, a coalition. So we're going to work with all of them, partnering up from the state VA and the federal VA to help those. And at the same time, our coordinator will help find everybody in that community doing all kinds of resources to add to our resource portal that we're developing on our website. But the key to it, the key to it is finding those communities, finding people like you guys who want to do that in your community, because whether it's state or federal, it's hard to see projects succeed when it's not organically developed and run by the community. So that's the goal, is to get into those communities and help create a model, help create the vision and maybe the enthusiasm, but find the right group and get it going. And that's what's impressive here. And you said it took a lot of tries with the food bank, and I can tell you right now, if a state agency was trying to do your food bank at the thing, and it wouldn't have gone 3 or 4 times till you got it right, it would have, after the first time, it would have been a scrubbed project. But local people with passion
Well, you
and
have to
dedication.
push it, and it's just, and we've been so fortunate that so many guys, and I mean, I didn't even know what to make of that when we started having it. And then we have 10 or 12 guys all the time. Sometimes our mayor shows up, which is a big uplift to everybody, the whole community, and Ruben, the guy that manages Seahawk. It's just really been a good ride if we can just keep the momentum going, because it just keeps growing. So it's growing on this end, but on the other end, we're getting kind of squeezed a little bit by our suppliers that supply the food are getting squeezed a little bit there, and so now, again, the VFW stepped it up, and we'll never have a veteran that needs food that don't get it. One way or another, we will get that done. I don't know quite yet how, but we will get it done. So,
And then, we want to support, serve, and advocate. So,
sure.
IDVA, I don't know offhand what can, but, if you have this program, and it's great. You have a CVSO can communicate to the DSO, and then through the state of Indiana, maybe we could help facilitate through an issue if you're running into an issue. Don't know if we can, but we can provide whatever we can.
There's a connection there someplace, because one of the guys from Indianapolis was down. He had an office with the VFW in the state level, and he knew of the passion we have with this food thing. And he come up and he said, look, if you ever, I've got his card at work. He said, look, if you ever have a need that you can't get filled, you call, and somewhere that need. So just when I thought things were going to go south on us with our food supply, then this guy stepped it up, and then we had some local people, local vendors that stepped it up to help us. But it's really been good.
Right on.
It's been good for the community because we have so many, but we've got guys coming from all over, not just Wayne County, Fayette County, Union County. I've noticed several names, because we have to get a name and an address whenever we give them a box of food. So it's been really good. But
That's great.
But with you being here, frankly, with you being here in the county, I can see this thing can get pushed beyond any limit that anybody would ever imagine. They could never think that this could happen in Wayne County. But,
Absolutely.
And I can just tell by talking to you,
Right.
a few times we've talked, that you're going to be out there pushing it, and that's what we got to do. I mean,
Right.
That's how you make it happen.
Happy to be involved in the meeting the other day, and start attending myself to the food bank, and it's a good slide over or segue into some specific benefits.
Sure.
So, the federal VA offers benefits and the states offer benefits. As far as the state of Indiana, I'll highlight a few benefits that we offer, but one I think would be important, and we'll make sure that everyone at the bank is supplied with our cards here, because it's a great opportunity for this specific benefit, possibly for some of the veterans coming in through the line, would be our Military Family Relief Fund. So the Military Family Relief Fund is a fund that we have for the state of Indiana that is provides up to $2,500 to a veteran who's experiencing an immediate financial hardship.
Oh, wow.
For a veteran or a family member. So the widow of a veteran is also, can also apply.
That's good.
So this program has been around for a long time, and I believe way back in the day, it was originally designed for the families of deployed National Guard veterans, way back. And it's morphed and changed and over the years and years and years, and to the point now where it's available to any veteran in the state of Indiana.
Are those brochures that you have that you put out, or?
Oh yeah.
See, I have a veterans area, if you will, at the dealership.
Well, we're going to get you stocked up.
And maybe this next week we can get together and I'll take you on a tour of
That
the
sounds great.
dealership and
Yeah.
how all that started. We have all the flags of all the wars and all that stuff, and we did have, I run out of them, from Dayton I had the medical part of it, and veterans we have a sign-in thing we want them to sign in, and if I see them sitting there or something, I'll come over and ask them, are they using their benefits and stuff like that, and then try to interline that with whoever they need to. So
Yeah, that sounds great.
Yeah,
I
it
do want to
works pretty
come
good.
see, and I know that you guys over at the dealership are a great partner to the veteran community, to the service office, and I've mentioned that as well. So I know that I'm going to arrange for Dennis and the rest of the executive team to maybe come and have a visit.
yeah,
And see
That'd
the
really
operation
be-
a little bit. I
they'd
think that would
really-
be
Our GM is a veteran.
all right.
So he is the one that really helps with a lot of things, and anything I want, if it's in the veteran community, it's
whole
just done. I mean, it's just, they just do that. So,
Yeah.
and now we
We
support
talking about first half?
the veteran community every month. They get, and then Ron distributes that out to whoever that goes. So it's really been a good ride, and they've really, over the last 2 years especially, they've really paid attention.
We got 3 minutes, guys. Just some things that you wanted to get out real quick, Joe.
Sure. So to
Finish
highlight
piece
that,
on that, on that.
the Military Family Relief Fund, we really want folks to know about it. It's been around a while, but in last July 1st is our new fiscal year. So prior to that, happy to say our Indiana legislators passed some legislation to change the eligibility in the program. Prior to that, we were denying a lot of claims, and we were able to analyze our data and understand why are we denying them. Well, some of the eligibility rules were in the way. One of them was the veterans' current hardship that they were experiencing needed to be tied to their military service. That doesn't make much sense, and it made for a lot of denials. So now, starting this past July 1, now that is no longer a barrier. That is not part of the eligibility. Another big one was veterans had to have served 12 months of active duty service. That was another one, especially with our large National Guard population, eliminating a lot of them and reservists. So that is no longer qualification. They don't need to have that specific 12 months of service. Another one we had a lot of trouble with was the veterans had to have we had the 12 months of service. We got getting through my points here. And the last one was the peacetime or wartime. So they had to serve during a wartime period. That is no longer the case. And the big thing there would be the end of the Vietnam era was 1975, beginning of the Persian Gulf, August of 1990. So that's a 15-year gap of anyone who served, didn't have that wartime service, weren't eligible. That's no longer a barrier to eligibility as well. And we even have the ability now to consider a few certain other than honorable discharges. And so those go straight to the Veterans Commission for a review, and then and that's where those specific ones go. So with these opportunities are really opening up what we can do, and happy to say we've given away from July on in that quarter, we've given away, we've processed twice as many applications as the previous 2 quarters and given away almost twice as much money.
Oh, wow.
So it's really starting to benefit. We want to make sure
excellent.
folks know about that. Because if they applied in the past and were denied for one of those reasons and still have a hardship, we want them to reapply because they will qualify now.
Well, we're going to be bringing Joe back, so this is not the
Excited
end
to
of
be
it.
back.
There's
Yeah.
so
This is
much
not the end.
information there.
Yeah, so much. And I got a
focus in
ton
on
of
some
things that I didn't get
benefits.
a chance to ask you. But yeah, so he's going to be back.
Cronin Toyota and Cronin Nissan are honored to partner with Proudly We Served, as well as the continued support of our local active and retired military veterans across eastern Indiana.